Thank you all so much for joining our discussions with the Fascia Masters. My name is Deanna Hansen. I'm a certified athletic therapist and the founder of Fluid Isometrics and Block Therapy. And I am being joined by my nephew, Quinn Castellane, the lead block therapist and the vice president of Block Therapy, and our very special guest, Victoria Goodman. Now, Victoria was our very first instructor from Ontario, and she has done some incredible things with her own body as well as with patients. So, Victoria, I'm just going to pass it right over to you right now and share your incredible story.
Oh, thank you so much, Deanna. And hi, Quinn. How are you?
Fantastic, Victoria. How are you doing?
Great. The sun is shining here. Spring is on its way.
It sure is.
and hopefully COVID out of the way.
Tell me about it.
And so, yes, I'm super excited to be here today. So thank you very much, guys, for the opportunity to discuss fascia and working in the fascia and block therapy and you know, just to share my story about, you know, just how it has changed my life. And so it's been super awesome. And so I've been doing block therapy now for, it'll be 3 years in June. And certified block therapy instructor for 2 years. And so, you know, you could say, you know, I've settled in, you know, I'm seasoned, you know, I'm a seasoned blocker, and very excited to be teaching classes and stuff. But, you know, what I'd like to do is just, you know, start out by, you know, kind of sharing, you know, how I got my whole life started. And so, you know, let's dial it back, you know, maybe age 15 or maybe even younger. You know, I'd like to tell a story about how when I was like 10 or 11 years old, I used to walk on people's backs. And so with the work that I'm doing now with Deanna in the bodywork program of the block therapy, it is totally full circle for me. So I think that's a really good starting point for me around 10. And I kind of was, you know, like a lanky kid who, you know, was, you know, tactile and you know, like doing like, you know, neck and shoulder massages and stuff like that. So kind of right off the bat, I knew I was into like holistic health and healthcare. And, you know, fortunately, my father, you know, started getting me to think about my career really young. So probably around 14, 15, you know, my dad was saying, okay, now you got to think about what you want to do. Like you have to decide, you know, like, you know, postgraduate. And so, you know, I decided to take aesthetics. And so that was really great. And in 2 years, I graduated from Seneca. And, you know, from there, well, actually, I traveled Europe and the Middle East. And so kind of discovered, you know, different ways of life using different, you know, herbs and essential oils and, you know, being in Egypt and, you know, there they had, you know, essential oils being distilled, and I was introduced to that. And so when I came back from Europe, I actually decided to go into aromatherapy, and I studied certified aromatherapy program with a registered nurse, Colin Padden from England. And so he was like one of the first Canadian trainers. And so I did aromatherapy and then reflexology, and kind of ongoing education was a requirement of the Aromatherapy Association. And so I continued every year pretty much after that with, you know, training in different holistic therapies and modalities. And so really loving doing that. And so in 1991, I opened my business actually in the middle of the Gulf War, if you would dial back and remember those times. And so again, you know, we're kind of in a war now, right, with this virus. And so kind of deja vu. So after doing aromatherapy and reflexology, I studied Bowen. And the Bowen therapy has been really great, and it is a connective tissue therapy working with your hands and, specifically targeted for pain. And so I've been doing that for about the last 7 years and getting really great results with the Bowen therapy. And then I stumbled across Deanna on LinkedIn. And I'm seeing this thing about block therapy, and I'm like, block therapy? Isn't block therapy like for kids? And I'm like, and she's going, no, it's not for kids. No, it's not for kids. It's a therapy. And I'm like, okay. And I looked at it for a long time. Like I'd have to say probably at least a year. And I looked at everything that Deanna had done, all her videos, and I thought, okay, let's test it out. I needed some type of to prove the science of the fluid isometrics. I had to test it out. So interestingly enough, I had a yoga block. And I've done a lot of yoga over the years, probably about 7 to 10 years of yoga. Just recreational yoga, but I never really used the yoga block ever, right? And then I said, okay, let's pull out that yoga block and let's do what Deanna's doing. Let's do a side plank on my shoulder, because my problem is I had a rotator cuff deltoid tear in my right shoulder, and I'd had this for over 2 years, and I'd have to say enough was enough. And I had done yoga and physio and chiro. And so I said, okay, this is it. I need to fix myself. And so I pulled out the yoga block and I lied down on my massage table, and I put the yoga block down, and I lied down side plank right on the spot. No warm up, no nothing, just, right onto the pain point. And I tell you, wow, it killed me. I probably shed a few tears. I recall streaming a little bit. And I remember Deanna saying, okay, you got to do it for 3 to 5 minutes. And so I'm looking at the watch going, okay, I got to do this. And then after a couple of minutes, I thought, okay, I can do this. And so then I started working it a little bit, and I started rolling over that muscle. And when I rolled over the muscle, to tell you the truth, it seemed a lot like a Bowen move to me, because when you roll over the muscle and it goes ping, that's the Bowen move. And that ping sends the vibration to your brain to tell your brain to unravel the muscle. So kind of when I'm doing say block body work, I feel like I'm doing block and Bowen together. So there's a real link there for me. And so anyways, at the time, I spent probably a good 5 to 7 minutes on that right shoulder. And beforehand, it was pretty frozen. So it was about there. So when I came off that table, I went, oh my God, this is miraculous. And I literally had this much more range of motion just in that one first trial of the block, the test of the fluid isometrics. And yeah, I was like, okay, yeah, right off the bat, I said, I got to do this for me. I have to do this to fix me, because I've been doing a lot of other therapies, and yes, they all help, but it wasn't fixing me. And after, 5 to 7 minutes on that one spot, I was like, okay, it feels better. I have relief. And so I was like, this is good. This is really good. So I for me, I study it, I research it, and then when I'm ready, I just dive in. And that's what I did. I just dived right into Block Therapy University and struck up a conversation with Deanna, and she pulled me right in and said, okay, yeah, yay, we're doing this. And so it's been fast, like a fast 3 years. And so the one thing I notice about Block is, one thing I was very interested in for me is, I'm kind of hyper. So I need to ground and calm down. And so, I found that the Block has helped me to actually learn how to meditate. So that was one thing that I was super interested in learning how to do, right? Is, meditate, because, everybody should meditate because it's the best thing going. So to go with Block, you've got meditation, which is the best thing. And so again, a really great close connection, combining it with your breath, and then the pain factor. And so, what we all need is an antidote for pain. And Block is definitely that antidote. And so we have to, welcome that Block into our tissues and just kind of breathe it out, breathe out the pain. And it's pretty easy. I mean, I can say that now because I've done a lot of work, right? But at the time, going through the whole process, of course, you're heading your pain, head on. And so it takes a bit. So I would say probably after the first couple of months, it really made a huge difference in my pain level. And you discover that you have all these stored pockets of pain in your body. And I think that's what happens when people get to the point of fibro, is that they just have all of these pockets of pain and they're just all on fire at the same time. And so, so Block has really changed my life. And, another thing that attracted me to Block Therapy was that, as I get older, I need to focus more on me and, think about my life after working, which is retirement, right? And so this is like part of my retirement plan, my transition. And so I'm just absolutely loving the online classes. And so, with those, you don't have to worry about renting space. You don't have to worry about driving to the location, which quite often is not close to home. And you can't have all your classes in the same location. So you're going to all different types of locations, which, is fabulous, but, it means a lot of running around. And, personally, I like to work from home. And so I have, the perfect space to do that. And so I'm really excited to be doing the online classes since January 2020. So I feel like I've been a little bit ahead of the game. And so that's been great.
So Victoria, thank you so much for that wonderful story. You had given me a testimonial from my book, Fascia Decompression, The Missing Link in Self-Care. And in that book, you shared many things that had changed for you. You mentioned your shoulder. You mentioned pretty amazing size loss and also anti-aging benefits. Can you share a little bit about the weight loss aspect of your journey?
Sure, absolutely. And so, you can't really see me with this jacket on. Let's take the jacket off so you can see the silhouette of it. Okay, yes, that's right. Okay, so I was about, 150 pounds, and I've lost at least 20, if not a little bit more. So let's say 25. Yeah.
So has that been strictly through blocking, or have you combined that with diet changes, other activities? What can you attribute the 20 pound loss to?
I would have to say it's mostly Block, because all of the things that I do, like I'm health conscious, I eat a good healthy diet, I walk, and I block. And so I haven't really been dieting, especially now. being, at home and cooking, all the time. So no.
I'm seeing some of your amazing recipes that you're posting, your
Yes.
lasagna and your pizzas. So yeah, it doesn't look like you're necessarily pulling back on the calories, and yet here you are looking absolutely stunning. And also, can I ask how old you are? Is that rude for me to do?
I'm 52.
Wow. Okay. So you look absolutely fabulous. And you also mentioned in your testimonial that you feel better, you look better than you did even when I think it was before you had your kid. Can you share a little bit more about that?
Well, absolutely. I have a lot more energy in the last couple of years. And so with that, I have a lot more creativity, which allows me to create a lot of business ideas. And so I have to say that I've been kind of full steam ahead with the brain and promoting brain health. And I definitely believe that the block and using the block around the neck. For me, I also had quite a few minor car injuries where they affected my neck. And so I had a lot of crunching and compression in my neck. And so since using the block, I have full range of motion. I have no pain or tension in my neck. And, it promotes the blood flow to the brain and the eyes, and so the skin. And so really cleaning the skin as an esthetician background, it's like homework. The block is great homework for me. And so I tell all my clients, use this block on a daily basis and you'll just feel healthy and wonderful.
Quinn, do we have any comments or questions at this time?
I'm just taking a peek here. So Victoria, you said some many great things, some many great one-liners. People really like block is the antidote to pain. Love it. That's so true. So again, like that's a great line. We might steal that one from you. And what I actually connected with a lot as well, and I'm just going to read this out to you. It's pretty much about block teaching you how to meditate, because I was very similar, or I am very similar. Like typically more of a hyper person, a little bit more intense, and block has really calmed me down and just teaching me how to be calm even when I'm not on the block, because again, that's connecting more to that parasympathetic state. You're not as go. You can tone it back a little bit, catch up with your breath, be more in the moment rather than those past future thoughts. So I really personally connected with that. And so when did you feel that aspect of the meditation piece? Did you feel that right away? Did that take a few weeks, a few days, a few months for that to kick in? Because for me, it was more of, I had a different intention with doing block therapy. I didn't really know what was going to happen or what it really was. Deanna's my aunt, of course. So I always understood it from a pain perspective and helping me progress with my sports, with my athletics. But it took me a little bit of time to really connect to that. Like right away, you feel calm. As soon as you do that belly position, you feel different. It's almost hard to explain because you're connecting to more of the present moment. So yeah, how did that really progress for you? When did you really start feeling, okay, I can control my hyperness or my intensity and be more calm and in the moment?
Well, I found that probably within the first month or so that I really noticed a difference with my breath, with my chest. I found it really opened up my chest. I had a lot of tightness and tension and actually some popping sounds come out of my chest when I did this. And that really concerned me. And I actually asked the doctor about that, and he just waved it away like it was a ridiculous, thing to be asking him about, and said that, maybe things were shifting, but there was nothing he could do about it. And so that was that. And so I think people start to notice the meditation aspect, when they notice that the time has gone by so quickly, like there is no time when you're on the block. Because, when I started, I did a little bit of the daily 15 minutes each day, and then I started adding yesterday's 15 minutes to the next day's 15 minutes, and then I just made it longer and longer and longer, and before you know it, I was doing like an hour and a half of block a night, and I was like, wow, I can't believe how late it is, and that I should, really go to bed now, right? And here I've been doing block, like losing track of time on the block. That's when you start to notice, oh yeah, there is something else happening here. And then there's a lot of memories that occur when you're on the block. And so I think that's part of the meditative aspect, because now you're relaxing, you're allowing the block to come into your tissues. It goes into those layers and layers, and then it finds those memories that you haven't thought of. And I think it even actually helps to affect our dreams as well. And so as we clean the tissues, we're letting go of maybe some of those fears that we had, that we dreamt about over and over again, as a child. And I certainly have a few of those repetitive dreams. And so, as you work through the layers of cell toxicity, you let that go. So when you see it, it's gone already. It's already left the body when you see it. And that's what people are afraid of when it comes to the healing crisis, is they're concerned about going into their pain. But what they don't realize is that is only a very short period of time that you're actually in pain. So say, for example, that 2-minute period of time, and then that pain turns to pressure. And then from the pressure, we're able to work in that pressure. And so, we could be there for quite a long time and do the work and kind of get the sense from our body, okay, are we done, right? And so actually listening to our body, tell us what to do, instead of our brain always telling our body what to do, right? We need to turn that around, right? And so, so block with meditation causes you to go in to your body. So you're not looking about, what you need to do later on. You're looking in your body and you're exploring and you're finding, the little bits and pockets of stuff that we need to get rid of. And so, yeah. So just focusing on the body, focusing on the breath. Number one rule.
Those are powerful words, Victoria. That was fantastic, because you explained that so well. And even when you were mentioning how time just goes by when you're on the block, I think every person who does a block therapy class, especially their first class, they're like, that was an hour and a half? I thought that was like 20 minutes or 30 minutes. And it's super bizarre, because I didn't really understand why that happened. I'm like, is that because we're spending 3 to 5 minutes in each position, or is that, but now we understand that is the meditative aspect. And to be able to dive into the body, into the cells, listen to what they're saying. And Deanna talks about this all the time. It's so important to listen to our body. And we can't listen to our body if we're all over the map. If we are always listening to other things and what kind of food to eat, what kind of exercise to do. Don't get me wrong, those are very important things, but we have to tap into our body and into our cells to really understand what's going on to a deeper level. And that promotes a healing crisis. But a healing crisis is one of the most important things that we can encounter. And we want to have healing crises all the time, because they're not necessarily intimidating or scary, maybe at times, but when you know what it is, it's like, great, this is awesome. I'm going to feel so much better on the other side of this. So I just loved what you said there. Those are some very profound words. And yeah, thank you so much.
And I just want to add too, because I think what a lot of people fear is when they talk about you need to face your fears to get rid of them. There's we're afraid of judgment. And typically if we have, and I mean, this is for me personally, if we have had behaviors or actions in our past that we're now ashamed of or that we feel guilty about, I think sometimes when people say we're going to dive in and we're going to touch on those fears or in that area of your body, it's scary because you think you're going to be judged for it. But the really beautiful piece of this is through the exhalation, you exhale it out of your body. There's nobody judging you. There's nobody seeing what's happening. It's you inside your body releasing what is going on. And in my 20s, when I was a huge mess, I used to have nightmares all the time, and 3-4 a week. And when you wake up from a nightmare, it can really affect the rest of your day and just how you feel in general. So when I started to clean up my life more in my 30s, those nightmares basically stopped. But what I find so interesting now is maybe, a number of times a year, like a handful only, I'll have a nightmare that will resemble what I had in my 20s. And I see it now with such a different lens because I'm aware that, wow, okay, I've tapped into some older stuff that's just coming to the surface so that I can view it and say goodbye. So it's such a beautiful process because it really takes away that piece of judgment. And when you can say goodbye to it, it's left you, and that you're diving into your body a little deeper and you're just cleaning things out a little more. So thank you, Victoria. That was fantastic. Your explanation on that.
Absolutely. So I'm just looking here at we got some great comments. People are really excited you're here, Victoria. And one person mentioned there is what you quoted, there is no time when you're on the block. Victoria, another big truth. Cellular memory, healing, and release at so many levels. So that's just, again, a great comment just to really tie together that whole understanding of meditating and getting into the cells, releasing that, bringing it to the surface, and continually to improve and heal the body through this practice. So we have a question here. How much blocking a day do you feel is necessary to really notice a difference with pain and restrictions for the average person?
Well, I think if you have pain on a daily basis, then you have a fairly serious issue and you need to treat it on a daily basis. So how long? Ideally, I think if you did 30 minutes in the morning and 30 minutes in the evening, 1 hour a day broken up into 2 periods of time would be ideal to really address your pain.
Love that. So, yeah, I absolutely agree. And again, that's a perfect start, and that can always change as you're going with your block therapy practice. Maybe some days you're like, I'm going to dedicate an hour and a half. Maybe some days you're like, I just got to get those 15 minutes in. But as soon as you start diving into your pain and understanding your body, you're going to start understanding where your cause sites are to your pain. If you have chronic shoulder pain, as you mentioned, or if you have fibromyalgia, which can be multiple areas of pain throughout the body, you start to tap into your own cellular memory and understanding and your restrictions in your tissue. And you'll know when you find a cause site. When you find a cause site, something's going on. This is like it's a new level of pain, but deep down how profound that pain is and how you need to release it. For example, I know my left psoas is a huge cause site for my right shoulder, for my right hip. And it's not like those are in pain, but just my asymmetries. And when I get in there, it's not just pain, it's emotions in there. There's sensations, and you just breathe. You just trust the process and you're in control. So if anybody is in chronic pain, which I'm sure we all experience pain or chronic pain to some degree throughout our life, it's just really, really like getting to know yourself, taking the time and understanding the process. And again, that can start from, I love the 30 minutes in the morning, 30 minutes in the evening, but just connect with your body, connect with the block, understand what's going on. Don't judge yourself and just follow the process. I think that's super important.
And I would just like to add as well that even 15 minutes a day makes a difference, because the foundational piece of block therapy is strengthening and training that full diaphragmatic breath. And then we carry that breath into our life. So we're not just breathing that way on the block, we're awakening that muscle while we're on the block so that we can continue to use that fantastic mechanism all of the time. And there's a time-space continuum. As we go through time, as we basically get older, what's happening with the force of gravity is we are compressing. So as we add time, we're decreasing space. With blocking, we're putting the space back into the tissue, taking out the time. So I often say to people, the more time you put in, the more time you take out. And, you know, one of the goals for many people joining this process is for reverse aging, anti-aging, whatever the proper term is. And so we can do that by melting through those adhesions, promoting blood and oxygen flow to cells, as well as cleaning out those cells so that flow is consistent. And when those cell membranes are aligned and strong and healthy, they don't go through a process of changing how they look. So it's really that compression factor from gravity over time that creates aging, pain, disease, because that's what causes us to collapse and to twist away from alignment. So with this process, we're literally going backward through time in our body so that we can keep our cells properly aligned. And if they are, then the effects of what we today understand as normal aging can be eliminated.
Mm-hmm. Definitely.
So, sorry.
No, I was just going to say, because yes, absolutely, putting in the time is like in the block is going to take time out of your tissue. And I absolutely love that. And I also think once you start to do more block therapy, you start to understand your breath, you start to understand how to release the restrictions quicker. So for a beginner, you might need to take a little bit more time to get that first layer of ice from an analogy to melt and release. And once you kind of break that initial ice, you can start diving in really quick. And if the more you do block therapy, the quicker you can melt with that period of time. So in 3 minutes of time, me on the block 7 years ago is a lot different than 3 minutes of time me on the block now. So the more time you put in just in general, the quicker you're able to melt through certain areas and restrictions. And then you get more in tune and intelligent with your body to prioritize where you should spend time to block. For example, like me, my psoas or my hip, my shoulder, etc. So yeah, I think it's all connected together, and it's super, super interesting.
There's also been lots of people that have reached out and mentioned that they, fell out of the practice for a while. And as soon as they got back to the practice, they were amazed at how quickly their body remembered how to breathe, how quickly they were melting. So that's a nice component as well. There is that fascia memory about what we're doing. And the thing we need to realize is the body wants to be healthy. It wants to be worked properly. We want to be breathing through the diaphragm. We want our cells to be aligned. So because over time we've fallen out and those adhesions are locking and holding us, when we start giving the body what it needs, it very quickly responds with positivity and health. And, the healing crisis is that showing in the moment of the body doing its job of moving the negative out of the body so that we can add more positive into the body. So are there more questions, Quinn? Because I have another big question for Victoria once we're ready to move on here.
Yeah, we have one more question here. So what is your advice on motivating your students to do block every day or on more of a regular basis? Many times I hear people say, I know I should get on the block, but I don't, and they just make excuses. So it's a good question, because I think that's with, and Victoria, I'm going to let you answer this, but I think that's with almost everything. It's just developing a new practice. But before I jump into this, I want to hear you, Victoria.
Well, I think it's a great question.
Mm-hmm.
And so I think the big thing for me is nobody else is going to do it. Okay. Nobody else is going to fix me up at the end of the day. It's me. I need to fix myself up so that I can move forward and enjoy a good quality of life and be accountable for my life. And so we need to put ourselves first, and I'd like to say that, block therapy works 10 times as fast as time. So, we talk about like putting in the time to turn back the time. I'm saying that it turns back the time 10 times as fast. So 3 years on the block, I feel, like I can take it back like 30 years easily. So 1 year of block, 10 years of age and compression. Okay. That is the motivating factor. That is, you want to change your life. Do something about it. Change your life. Here's an opportunity. It's a block of wood. Work it. Work it to the bone, and it will work for you. So, I think there's no excuses. There's no more excuses. And now, with the learning capabilities and being able to learn from home, learn online, learn by video, learn live classes, there's so much access and so much support and guidance with block therapy. So, I say to a lot of people, there's no other company like it. There's nobody else that does this. Yes. Thank you, guys. Yes.
That
okay.
Awesome.
That was a fantastic answer. And it's so true. It's with anything. If I'm wanting to go to the gym and do a bodybuilding show, there's no excuses. I'm going to wake up at a certain time. I'm going to put in the time. I'm going to eat my meals. I'm going to do this. I'm going to put in time on the block because I know block therapy changes my physique the quickest than anything else out there. So absolutely. And having an accountability partner is huge too. But even just joining our private Facebook community group, if you just go in there, you can hear what people are saying. You can ask people questions, get motivated through there. But you have to want to be able to make a change to change, because so many people are going to procrastinate and just say, I'll do it tomorrow, I'll do it the next day. You're never going to do it if you keep pushing it off to the next day. So that's where you have to consciously make that decision. Now is the time to change. I'm in pain. If you're in pain, you got to start now. There's no tomorrow to start. Yeah. And that's the biggest factor. If people are in pain, those are the people I find that are actually jumping on the block quicker because they're already in pain. they want to get out majority of the time. But if people just know it's good for them, or it's going to help me with this or my digestion or whatever it is, they can procrastinate a little bit more. But again, going to that accountability piece, I think some people just need that initial little boost. And once that person gets rolling, they start developing that routine. And repetition is very important. So if you block off a certain time in the day, every morning when I wake up for 30 minutes, I'm shutting everything off. I'm not looking at my phone. I'm not looking at my emails. I'm literally taking this time for myself. Right before I go to bed, I'm going to do the same thing, shut off everything and just take that time for yourself. If you want to make change, you want to get out of pain, that's the way you do it. And there's no excuses.
And I would suggest to everybody to start small. If you're afraid of the time commitment, start with 5 minutes, 15 minutes. In 15 minutes a day, if you do it every day for 3 weeks, you're going to see and feel change. If you don't have 15 minutes, even just breathing with that block or a book on that belly position in 3 weeks, you're going to notice change. And then it's easy to step up to that next level because you're already aware that it works. And for most people, once we've identified something that actually works in a positive way for us, it's easy to give that time in because you gain time back. You become more efficient. You're more productive. You feel better. You play your sports with greater ease and enjoyment. You're more creative. You're not focusing. Like when we're in chronic pain, it really sucks the life right out of you. It can keep you focused in that negativity, in that spiral, in that fear mode. So when you start diving into that pain and you connect to the pain that's deeper than what you're consciously aware, and you start releasing it on your own, it's extremely empowering. And the reality is we are all in pain. Some of us all the time, some of us part of the time. Pain is a language. It's not the problem. It's the fear of the pain that's the problem. So diving into this practice and simply connecting to your breath and seeing how we can move through those layers of pain, it gives us that sense of control that, especially today, like we've had everything taken from us at this very moment, so many of us, and we feel a loss of control. taking control of your breath, of your own fascia system, is a fantastic way to feel empowered and to start bringing joy back into your life. So Victoria, another thing we wanted to discuss today is you've been doing some absolutely incredible work with your patient, Danny, who's given us and you permission to share the story and the photos. So can you dive in here and share a little about the experience that you've had with him?
Absolutely. Thank you. What a great question. And so I've been working with this gentleman, Danny Kay, and he's got a great story, and it's been awesome. It's been amazing, the results so far in such a short period of time. And so I'll just start out. He has 40-degree scoliosis of the spine, as well as a kyphosis. And so he's got two types of scoliosis, and the kyphosis is, the arched back. And he was going to have a surgery done for straightening his spine. And this would involve putting a metal rod, through his spine. And, my client was talking with his doctor, and the doctor mentioned that he would have to break 4 vertebrae, I believe 8, 9, 10, 11, 12 vertebrae, to insert the metal rod into his spine to straighten his spine. And so this kind of gave him the willies. He didn't want to, kind of do that. And so it made him kind of step back and reassess, what other options might be available. And so interestingly enough, he came up with you, Deanna. And I guess pictures that he had seen online with the work that you've been doing with scoliosis and block therapy. And Danny wanted someone to do a house call for him. So he wanted someone to come and do some work with him for his scoliosis. And so through you, he found me on the teacher's site and contacted me. And then, it's been a family commitment. And so there's the other parties involved supporting the health of Danny. And so I've been visiting him starting in January. So this is how it worked out. We set it all up so that he would have the block for the beginning of January. We set up an appointment for his bodywork sessions, his block therapy bodywork, as well as Bowen therapy treatment. After he would have had 10 days of kind of limbering up on the block. So getting his body prepared before doing the body work. And then I took before and after pictures of his very first treatment. And, afterwards, after the first treatment, before taking the pictures, you notice that there's a change, but you don't really notice until you put those before and after pictures side by side. And so when I got home and I did that, and wow. And so that was 2 hours of body work for the first treatment, and the changes were dramatic. And then I have been visiting him. It was every 2 weeks for 3 treatments. So basically in 6 weeks, he had 3 treatments, which was 6 hours of body work. And then we, took after photos again, and there was a huge dramatic change in his posture. The kyphosis has really straightened up. So, for one, he's really straightened up. But even his S-curve is much, much better. So I would say about halfway there. And so Danny's made a goal for himself to wait and see how it goes with his holistic block therapy treatments and Bowen. And then be re-evaluated by the doctor in 6 months. And so he's decided to take out the 6-month member site to help accelerate his journey of straightening his spine. And, I really, truly think that we can do it. And Danny's actually a pretty healthy guy. And so there's no reason why he shouldn't be able to restore his spine to a fairly normal level of scoliosis. What we would say maybe 5%, maybe between 5 to 7% would be where a lot of the society have scoliosis. It's just to what degree, right? And so he's doing really well. He's said that he's feeling so much better. His blood flow and his circulation in his legs, and the lengthening of his neck and the whole spinal alignment. With the posting of this discussion, we had, like a before and after picture of Danny 85 days and what has changed. So, have a look at that, and, feel free to reach out if you have any questions.
And you have just done such a phenomenal job. And I am so pleased that he has put off the surgery, because what we discuss in block therapy all the time are the cause sites. And I've worked with so many patients with scoliosis, and one of the things that we think scoliosis is really a dysfunction of the spine, but what's causing that dysfunction is how the limbs are torquing and pulling the spine out of alignment over time. So to imagine going in and putting a metal rod in the core of the body without changing the dynamic of those cause sites, to me, is something I'm really pleased he didn't follow through with at this time, because I have no doubt with the work that you're doing with him, with Bowen, with block therapy, and the work that he's doing on his own, that we will definitely be able to only continue to progress. And that comes back to the conversation that Quinn was mentioning. The more you do it, the faster those results. So the 3 minutes in the beginning when you're starting are very different than 3 minutes on the block, months later, when your system in general is that much more warmed and heated and receiving that positive flow. So I am so excited to continue watching your progress with Danny. And Victoria absolutely has such amazing firsthand experience. So anybody with questions, Victoria is definitely a fascia master in this regard. So thank you so much, Victoria. Any questions, Quinn, or comments from you?
Yes. There's some great comments. Here's a great comment to you specifically, Victoria. I've been working with Victoria and have loved her virtual classes. Thank you so much for introducing me to Block. Victoria, you've introduced a lot of people to block therapy. This is so exciting because a lot of people here are commenting, and you're doing some amazing work. So that's super exciting. Stunning. Looking forward to hearing more of Danny's progress. That's very inspiring. I'm hooked on blocking. If I was younger, I'd get the block therapy logo tattooed on my body. That is so funny that you mentioned that.
Do you want to share?
Because I'll make this really short. I am in the process of designing my block therapy tattoo on my back. I'm actually going to get a big back piece done. I'm kind of saying that out now, so I have to get it done. I'm getting it done in Spain, but not till 2021. And yep. I think a lot of people eventually are going to get the logo because it's an absolutely beautiful logo. So yeah. So those are all of the questions and the comments so far. So those will kind of keep rolling in as we keep discussing. But yeah, is there anything else, Deanna? Anything else, Victoria?
Victoria, I would just love it if you would share any final thoughts you may have, how people can find you, and what do you see for the future of yourself with block therapy?
Thank you, Deanna. So I just wanted to finish off with Danny. So Danny's a perfect example of how you can change your life, okay? He made a decision in his mind that there's another way, and he sought out that other way, and he found it. So if you look, you shall find, right? And so you need to be seeking what you need. And so, block therapy is just perfect because it kind of gives you everything that you need in one package. But yes, Danny now, he has missed a treatment, because of due to COVID. And so he's been 120 days on the block. So such a huge difference. But, from the last treatment to this treatment, from the last treatment to the latest photographs, he has actually changed a lot. And so he's not as bony in the back, and you can see that his skin has decompressed and it's soft and it's fluid, and that things are really like moving around just with the block therapy alone. And so still continuing to maintain his alignment and even moving himself forward from there.
And if I can add, sorry, Victoria, just because you just touched on such an important piece. When you showed me, we had this discussion yesterday looking at his back, and you can see the plumping up of those cells, the oxygenation, the cells becoming nice filled balloons. So translate that for people worried about aging into the face. And you can just get this beautiful understanding of how that anti-aging benefit occurs with the oxygenation. And also, when I saw the before and after of what he's done this past month, the difference in alignment of his shoulders was truly phenomenal. Yeah. And so again, we're seeing now that his time on the block, because he has only had this for the last month or so, but his time on the block is adding up faster and faster and faster, which is why I have no doubt it won't be more than a few months away, but where you're sharing more photos and everybody's just in complete awe of his progress.
Yeah, he's doing an awesome job. And so, yeah, really shows what you can do for yourself. And there's been so many other people who have used the block therapy for scoliosis with great success. And so you wanted to ask about the skin piece. And so let me just touch on that for you, Deanna. And so we have unused estrogen and hyaluronic acids sitting in our connective tissue, like little treasure chests of vitamins and anti-aging nutrients. And so by blocking, it plumps up the skin, and it evens out the lines and the wrinkles, and helps you to look younger, feel younger. But what is really going on is really cleaning those tissues and helping with scar tissue and sun damage and using the block on your forehead and on your eyebrows. Oh my gosh, this is the best for relieving those areas that are so full of tension that bring our eyebrows and our forehead down and put pressure on top of our eyes. If you want to get rid of headaches and lift up your eyes, then use the block on your eyebrows and on your face and your neck, and it will just give you a nice rosy, healthy look.
Wonderful. So where do you see the future of you with block therapy and where things are going?
Well, what really lights my fire, Deanna, is talking to people around the world. And so I'm really loving the online block therapy classes. I've also been doing one-on-one sessions with people. And I've also been doing a little bit of what we call distance healing. So remote treatments virtually, and with great success, I might say. And so I can really see myself, doing a lot of the same working from home. But, I was doing a lot of outreach before COVID was happening, which, I like to create a balance. I think for me, it's all about creating balance. And so I'd like to have more me time and, of course, less working hours. Like everyone else. And so I think one thing that COVID has is teaching me is to appreciate, our time together and creating that balance. And so I'm looking at, kind of reducing my working hours so that I can have more recreational time, more gardening time, and just kind of like maybe having a 4-day weekend. How does that sound? That's what my future holds. No, but at the same time, helping more people. This is what I want to do. This is what's in my heart, is to help people. And block therapy helps me to do that on a bigger, kind of more grander scale, but simpler, where I don't have to run so much, right? Because, we can't keep running. We have to take charge. We have to take charge of our life. We need to, decide what we want and how we want it. And then just stick to that.
Absolutely. Well, you are absolutely doing that, and you are rocking the block. I am so impressed with what you've done in the 3 years that we've been working together, and just so grateful that you are here with us and you're sharing your beautiful heart with the world, and people are responding and people are getting better. So I just love this. Quinn, is there any last comments before we wrap up?
Yeah, actually, Wendy just mentioned I had a remote treatment with Victoria. It was the best treatment that I've ever had from an energetic perspective. You really need to give that a try. So from a remote perspective, again, that is incredible. That is super, super cool. So there is one more question here, and I'm sure we could talk about this question for a long time, but it's from Coral Cadman, who's been with us for a very, very long time. She's 12 weeks post right hip replacement surgery, walking really well and feeling great overall. Scar is still tender on the surface, but healing well. Any suggestions?
Victoria, would you like to take this?
Sure. 12 weeks post-op?
It was, yes, 12 weeks post-hip, yeah.
So she's good to go, I think. And so, circle the wagon, work a lot of round the spot. I would probably do some butt sculpting. I think that would do it. Yes, because that gets right into that piriformis, and I think that's, piriformis and psoas. That's where she's gonna really want to be focusing around, and then leave the sorest spot to last. So if that is the hip, then leave that to the last spot, and then kind of repeat that 2 or 3 times.
Great advice, Victoria. Hi,
Fantastic.
Coral. Thanks for the question. We got to touch base together soon. So Victoria, we're going to be posting all of your links so people can find you. I'm sure you're going to be having an onslaught of people reaching out to you. Do you want to just quickly share your website and where people can reach you now, just verbally?
Sure. Okay, so I'm owner and operator of Victoria's Holistic Day Spa. So my website for the spa is www.victoriasholisticdayspa.ca. And my block therapy site is www.blocktherapy.com/Victoria Block Ontario and /.
Awesome. Well, thank you so much for joining us. This has been an absolute pleasure. And thank you for all of you who have taken the time to partake and listen. And you'll be able to review this recording as much as you like. It will be on our YouTube channel. And thank you again. And Quinn, is there any last comments before we leave the meeting?
Great discussion, everyone. Thanks for doing these sessions, Deanna and Quinn. They are so informative and fun. They really are. And again, it's just so amazing to be able to have all of you being able to be guests and share your journey, your experience with block therapy, how you're helping people, and just spreading the words, spreading the love. It's all about healing everyone globally. So we're able to do that with technology, as Victoria has mentioned. We're able to do Skype, Zoom sessions, which is incredible. But other than that, again, thank you all for tuning in and for listening to this discussion. And make sure you like this video, give it a thumbs up. This has been such a fantastic opportunity that we've all had to be able to have Victoria with us. Make sure to subscribe to the YouTube channel, hit that little bell so you get notified when we upload this edited version. And that is everything, guys. So have a fantastic rest of your day, and we'll see you next week, same time, same place, 10:30 a.m. Central Time.
Bye-bye.
Thank you. Have an awesome day.